Hi guys, welcome back to my channel. It's your girl Q or N for nasal, not my government name, but like, yeah, welcome back to my channel. We're back at it again with another video, and for those returning, welcome back. For those who are new here, I hope you stay and I hope you enjoy what I have in store for you. So before I say that, okay, I know I've already, the title of the video is right there, but before we do, I want to do something real quick, and I've changed my top. And the reason I changed is because this is the closest color I have to what I want to talk about, and I just want to raise a bit of awareness on cervical cancer. Yeah, so I want to talk about cervical cancer prevention, and this video is way late, but I had to do it. It was like a public service. So January was Cervical Cancer Awareness Month, more specifically the week from the 23rd to the 29th. So it's really not, we're barely like 2 weeks later posting this video, but like I feel like it would still have the same impact because the truth is the truth. Doesn't matter how you twist it. So this is when basically cancer starts from the cervix. So that's like the main place where it started. I'll insert the diagram here right now. So cervical cancer happens from the cervix. So the cervix is the part that connects the vag to the uterus. So it's basically like the neck or the mouth of the uterus. Well, if you're in Southern Africa, more especially Southern Africa, more especially Eswatini, then you definitely need to be concerned about this, because we as a region are the most highly affected in the world. Actually, in the world, Eswatini is leading. Like, we are the number one. Like, we are the ones in the world beating them at cervical cancer in terms of we're the ones who have the most diagnoses per year. We're the ones who have the most deaths per year in the world. I say it's a travesty for you to die from cervical cancer, because it's something that, when caught, it's one of the few cancers that can be prevented. So it's crazy. I found it crazy that at least 241 women are diagnosed every year and 118 die every single year, like from something that is preventable. Cervical cancer is caused by the HPV virus, or what you would call the human papilloma virus, and it's the same virus that causes genital warts. So it's basically an STI. You get it from, it's a sexually transmitted infection. So at least half of sexually active people will be infected by HPV, but at some point in their lives. But only few women will actually get to the point where it develops into cancer or something precancerous. One of the risks for getting HPV and hence cervical cancer is having HIV or being HIV positive, and that is because your immune system is just actually lowered and your body is not able to fight off the HPV like other people who actually do recover from HPV. Having multiple sexual partners, especially without using protection, and having an early sexual debut. So if you started having sex early, chances are you'll get the HPV infection early, and hence the cancer has a longer time to develop in your body. As well as people who are smokers, and it's also got to do with lowering the immunity in the body. It's basically without symptoms for a very long time, because it's a cancer that develops very slowly from stage to stage. Some say it takes 10 to 15 years to move from one stage to the next. But there are symptoms for those who have actually gotten cancer, and that includes having an abnormal vaginal discharge, and then as well as bleeding abnormally, especially for women who are menopausal. Also, if you experience any pain during sexual intercourse, then you definitely want to go see a doctor about that. Screening is basically a process where we try to do the necessary tests to see whether you are at risk of getting the cancer. It's not a diagnosis, but it's something we do to prevent you from getting there. We have a VIA or a VIA, where you go if you are of a woman of childbearing age, and if you're sexually active, you go to the hospital. It's just a quick process where they check your cervix to see whether there are any lesions or whether there are any changes in the way that the cells of your cervix grow. So the VIA is mostly for women who are premenopausal or women who have not gone through menopause yet, that we use in Eswatini. For those older, the ladies who have entered menopause, in Eswatini we do a pap smear, where it's a similar process where they lie down and a certain brush to get a bit of the tissue there, just so they can actually visualize it and see under a microscope. They can't use the vinegar due to the changes as you stop going to your period, so hormonally you start changing there. Another test that they do in more developed countries is the HPV test, where they actually check if you have any HPV in your system. There are normal results, firstly, where it's just everything is going well, and they'll ask you to come back after some time. For HIV positive women, it's after a year. For HIV negative women, it's after 3 years, but unless there are any changes in between, then you go to the doctor. Then there are unclear results. These are termed under Ask Us or atypical squamous cell of undetermined significance, and this just means that they are seeing some changes, but they're not sure if it's really a precancerous thing or it's just like normal changes that you would find maybe in pregnancy or during menopause or stuff like that. Usually with this, we try to wait it out and see, and at a later date, maybe you might come back a bit sooner, not in the 3 years, maybe you'll come back after a year, or if there are any changes that you experience in your body. If the results are abnormal, then it means there's changes that they found and they are most likely caused by HPV. Now, with these changes, you might find low-grade or high-grade changes, and the low-grade is usually minor. It's something minor that usually after some time will revert back to normal cells, and the high-grade changes are usually more serious and are most likely to put you at risk of changing further into cancerous cells. Precancer is something that is very much treatable, and there's cryotherapy where they basically use cold temperatures to remove or to kill off the cells that are a bit different or that are showing signs of change, as well as thermal ablation where they use heat. Then there's something called LEAP, where they basically remove, using this loop, it's like this loopy wire, they remove the parts that has the lesions or the changes. If you haven't been able to treat at the precancer stage and you've gotten to the cancer stage, there are treatment options, which is surgery, where they can try to actually remove. First of all, before removing anything, they have to stage the cancer at what level it's at. Once they do that, they establish what can be done for you. They can surgically remove, especially if it's still confined within the cervix, they can basically remove whatever part is cancerous. And this is in conjunction with radiotherapy and with chemotherapy. Once you get to the cancer stage, it's quite a very painful process, and it's just something that's quite unpleasant to deal with. So we do sympathize with those who are going through cervical cancer right now. Cervical cancer can be prevented, and you need to know now that as many people as possible that you can send this message to will do a whole lot of good, because a lot of people don't even know that this is preventable. They don't even know that cervical cancer screening in Eswatini is basically free. There are so many clinics in Eswatini, both in the public and the private sector, the NGOs, everybody. They are in this fight to beat cervical cancer because it's something very much preventable. Also, it's important to try and practice safe sex. Have good sexual behavioral practices, because you only have one life, and this is just one problem amongst many. If you don't take care of yourself, stick to one partner and use a condom, and just try as much as you can to take care of yourself. If you feel anything funny going on down there, go see the doctor, go see the nurse. Also in Eswatini, another thing that I didn't talk about that can help prevent HPV is the HPV vaccine, and it's finally here, guys. There's a study done by ICAP. However, it was just confined to those with HIV so far, because they are the most at risk. And also, this vaccine is available. So far, the people who were involved in the study were from the ages of 9 to the age of 26. This is because these are people who are still at the earlier stages of their sexual activity, and this is even before they are sexually active. So guys, I know this was a very health talky sort of video, but like I felt it really in my heart to talk about it. And this is just not confined to Eswatini only. This is universal information, and those living in SA, those living in Mozambique, Lesotho, basically if you're part of the SADC, then you definitely need to stay on the alert. Prevention is better than cure. Anyway guys, post your comments down below if you have any further things that you want to add to what I've said, and if you have any questions, just let me know, and I'll see you guys on the next video. Bye.